Hello and welcome to My Dietitian Journey. I'm Felicia, owner and registered dietitian at Paraz Nutrition and My Dietitian Journey. This video will cover my basic checklist for working with new patients. There's a lot of different things to consider, and I hope that this video is helpful in just making sure that you have all of those boxes checked. Prior to your first appointment with a patient, you want to make sure that you have all of the documents that you need on file. For any new patients that come into the practice, they're usually scheduling through the website, but they can also call the office directly to get scheduled. If a patient schedules through the website, I get a notification about the appointment, and then I go into the EMR that I use, which is Simple Practice, approve the session, and generate new patient paperwork. If the patient calls the schedule, the paperwork is generated during that phone call and then sent over again through the EMR, and they would fill it out on their end. For new patient paperwork, I have a fillable new patient form, which collects information about their medical history, medications, reason for the visit, biometrics, and other general information. I also have documents that are digitally signed by the patient, including informed consent for telehealth, informed consent for nutrition services, and also the practice policies, which is posted on the website. Patients are also sent a notice of privacy practices, which is a PDF also available on the website. With the EMR that I use, there is also a demographics form, and this is going to collect the patient's date of birth, address, phone number, email, and also insurance information. As a provider for insurances, there's two key things that you want to make sure you have on file for your patients. One is the patient's insurance cards, front and back, and also their driver's license or photo ID, front and back. Now, for some EMRs, there's a spot to upload insurance information and those insurance cards directly in a demographics form. In some EMRs, this is not the case. So in the welcome email that all new patients get for the practice, I have a sentence that says that they need to upload to the portal or send their insurance cards through email, or they can even text them as well. While front and back of the insurance cards is necessary for being a provider, it also is going to give you key information, including the provider line to call. So if you need to verify benefits, that number's on the back. And then a lot of them will also state where you're going to submit claims to. Outside of collecting patient information, before the first session, you want to make sure that you review the medical policy for the insurance plan. Insurances will usually have nutrition counseling listed as a separate policy. They may have it called medical nutrition therapy or nutrition counseling. It's something that you want to also look for in the preventative care policy. If you're also engaging in telehealth, you do want to make sure that you review the telehealth policy. It's going to let you know, one, is telehealth covered, and two, which codes that you need to use for billing. I cannot stress enough how important it is to verify patient benefits before the first appointment. While this can be very time consuming, especially at first, it is worth it to help ensure that you're getting paid for the services that you're providing. When calling to verify insurance, you want to make sure that you're specifically asking for the CPT codes that you plan to bill for. So these are 97802, which is the initial MNT session, and 97803 for the follow-up session. You want to make sure those specific codes are covered, how many visits a patient gets, if they need a referral, if they have a copay, coinsurance, or deductible. You always want to get a reference number for your call, and I suggest having especially those ICD-10 codes ready to go to then verify against the CPT codes that you're providing. Otherwise, sometimes you end up getting really generic information about the patient's policy that doesn't relate to medical nutrition therapy. Now, you can't do any of this without having the patient information, so you need their member ID and also their date of birth. In the welcome email that gets sent out to all new patients, I have in there that they need to complete their paperwork 48 hours before the initial session, and this is so benefits can be verified. Over time, you will start to have similar plans that you're seeing for insurances, and you may not need to call the insurance as frequently as you are with starting your practice. Also, some insurances are very straightforward and you don't need to call. So for example, Medicare, they cover 3 hours of MNT for the first year and then 2 hours after that. You can also get additional visits using a G code instead of the CPT code, and then having a new referral on file. Number of visits is standard for Medicare, but they only cover for diabetes and renal disease. So if I have a patient that has cardiovascular disease, I know right off the bat, Medicare is not going to cover it. I don't need to worry about calling Medicare and wasting my time. So once you know what the patient's benefits are, you want to make sure that you reach out to them and let them know what those benefits are if the insurance is covering. And this is going to be through what's called a good faith estimate. In the event that a patient does have a responsibility on the good faith estimate that would specifically note what they are expected to pay for the session. I also recommend letting patients know about their coverage limits on the number of visits that they have before the first session or at the beginning of the first session you have with them. One of the last key things to have on file before you see your patient is to make sure that you have a referral if the patient's insurance requires that. So for Medicare, referrals are required. For commercial plans, it's going to vary. And again, when you reach out to the insurance company, verify benefits, this is going to help you make sure that you know what other steps you need to take before seeing that patient. In order to obtain a referral, you need to have the patient's name, their date of birth, and then their physician information as well. So I have a spot on my new patient paperwork where the patient indicates their primary care physician and then any other specialists as well. If your patient doesn't require a referral for their insurance, you may still need to call the primary office to get billable codes. So those ICD-10 codes, there's certain ones that you can use without reaching out to the physician. So BMI codes, and then also Z71.3, which is dietary counseling and surveillance. It is the most generic code that you can use for nutrition counseling, but not all insurances take it. Certain BMI codes are also covered, again, very much depending on the insurance plan. But if you need a medical code, like a code for diabetes or obesity, you will need that from the physician. I do get a notification once a patient completes all of their paperwork in the portal. And then once it's completed, I go in, check their forms, see what insurance they have, if they have a qualifying BMI for billing, or qualifying medical condition that can be used for billing as well. If I need billable codes, I get a referral or an encounter note sent over before calling the insurance company. And again, this is to verify those ICD-10 codes against the CPT code. In some cases, I don't even need to call the insurance because I know a code isn't billable, or I know it is definitely billable, so I don't need to worry about wasting my time and again, calling that insurance company. So for example, I mentioned Medicare and the code, let's say I receive from a primary office, is I-10. This is essential primary hypertension. I know that that's not billable for Medicare, so I would, one, look at the patient paperwork, see if they do have diabetes, because I want to make sure that I'm specifically asking for the codes that I need when I call for a referral. In some cases, when you ask for a referral, the primary care office will want to say, let me put it in electronically, but you may not have access to their system. So generally, you're going to want to make sure that you have that faxed over to you, which means that you need a HIPAA-compliant fax number to accept those referrals. Some primary care offices will also request that you fax them a request with the information that you need, which is actually better because they have exactly what you need on that document, but you do need to have that first step before they'll issue a referral. So to keep everything organized, every Friday, I check my upcoming week for new patient appointments. I see who still needs to fill out their paperwork, and then I scan the paperwork that's on file to make sure that I have all the information needed, decide what insurances need to be called, what doctor's offices need to be called, and when it makes sense to do those things based on when the patient is scheduled. I do have automated appointment reminders in my EMR, but if you don't, I would build into your routine a day to send out those reminder emails about paperwork. While there's a lot more involved before you see a patient for the first time, there's a lot less work as you continue to work with that patient. I do want to mention that for all patients, I complete their chart notes during and usually right after that session. And then billing is usually done in batches, usually weekly, to make sure that timely claim filing requirements for the insurances are met. I hope hearing about my new patient checklist and the things that I consider before seeing a patient has been helpful. Thanks so much for listening, and reach out if you have any questions.